Hi, this is Dr. Bob Dannenhoffer, the Public Health Officer for Douglas County, and here today with another of our COVID conversations. Today is November the 4th, and we're very pleased today to be joined by Jennifer Green, who's the Chief Nursing Officer at Lower Umpqua Hospital. As always, this is a chance for us to answer your questions, and we have quite a few questions today about booster shots and shots for kids, but also a chance to give you a sense of what's going on with COVID around the world. So around the world, COVID is pretty quiet except in Europe. And that increase in cases in Europe and Russia has caused an increase in cases and an increase in deaths in the world. Russia especially is struggling. In Russia, they've had relatively low vaccine coverage, and the vaccine they've used has been the Sputnik vaccine, an mRNA vaccine made by the Russians, which does not seem to be particularly effective. So they have low coverage rates of a particularly ineffective vaccine, and thus not surprising that they're seeing a high number of cases. Right now, they have quite a bit of lockdowns in Russia because of the spreading amounts of disease. The rest of the world is pretty quiet. So Eastern Europe is struggling, but Western Europe is pretty quiet. So Spain, France, Portugal, and Italy are having a relatively low number of cases. We always very carefully follow the UK because many times they have done a few weeks ahead what we're expecting to see, and they are seeing a fairly high number of cases, certainly not a huge surge, but a fairly high number of cases, a moderate number of hospitalizations, but a relatively low number of deaths. In the UK, almost all people over 50 are vaccinated, so they're not seeing much disease in older people, but they're seeing a fair amount of disease in younger people. And in those younger people, some are getting hospitalized, but not many are dying. In the US, we're seeing still a lot of disease in Alaska, still a lot of disease in the Mountain West. We're starting to see a little bit of increase in northern Nevada. And so that it's just in that area there. The coasts are pretty quiet, and the Southeast, which really struggled with this in August and early September, are now pretty quiet. When we look in the US, pretty much the only thing that's circulating is the Delta variant. We're not seeing any other new variants, and that's a good thing because we've had some experience with Delta and know that with enough vaccination and public health measures, we can keep it under control. In Oregon, we're starting to see a little increase in the number of cases. So Oregon had a decline for 6 weeks and is up again a little bit in the last week. Most of these cases are in Eastern Oregon, and especially Deschutes County, which seems to be struggling this week. Malheur County, which has struggled during the entire pandemic, continues to struggle. In Western Oregon, it's pretty quiet. We're seeing a slightly increased number of cases in Douglas County and in Lynn County. But other than that, Western Oregon seems pretty quiet. Douglas County is continuing to see a fair number of cases, a fair number of hospitalizations, and a fair number of deaths. Now, this is clearly down from our peak, but still we're at numbers of cases, hospitalizations, and deaths far higher than any time before August of this year. So we're still struggling with that. In terms of vaccinations, we're making some progress. Last week was one of our biggest weeks for vaccination, and I think this week is going to be even higher. Almost all the clinics and pharmacies have vaccine, and we have a FEMA event in Reedsport this week, and we'll talk a little bit about that with Jennifer later, but they've done a bang-up job in just 3 days. They've given hundreds and hundreds of doses of COVID vaccine, and they've actually run out of flu vaccine last night. We resupplied them today because they're giving so much flu vaccine in addition to COVID vaccine. The news this week in vaccines is that booster doses are now approved for everyone over the age of 18. So if you got a J&J vaccine, we're recommending that everybody get a booster dose. That booster dose can be with any of the vaccines. If you got the Pfizer or the Moderna, you have pretty good coverage, but we are recommending for people 50 and above to get a booster if they have underlying conditions, and for people 65 and above, even if they don't have underlying conditions, to get a booster. I'm due to get mine tomorrow, and I would recommend that people do that. For people who are 18 to 49 who got the Moderna or the Pfizer, the additional benefit is small, and so if you want to get a booster, you can, but it's not required in any way for you to get that. The biggest news this week is the approval of vaccine for children 5 to 11. So that approval wended its way through the FDA, then through the CDC, then through the state, and now it's fully approved. The first doses of this arrived in Roseburg yesterday, and we're going to be distributing them tomorrow, November the 5th, and we're hoping that we can get kids vaccinated. Now, the vaccination for kids is interesting. I mean, clearly when you're somebody my age, the risk of the disease is very high. So if I would get the disease, my risk of dying is maybe 5%. And so it's really good for me not to get the vaccine. And as you get older and older, the risk goes up. So that for people 80 and above, the risk is maybe as high as 10% if you get the disease. So we do worry about older people. As you get younger and younger, your risk of dying is low and your risk of hospitalizations is low, but it's certainly not nothing. So we've had a couple of kids less than 18 who have been hospitalized, one who was in the ICU. We've seen about 20 cases in our practice, and the kids who have it are pretty miserable. This has been a fairly significant disease, and most impressively is the post-COVID stuff. So kids who get COVID then have these long-term symptoms. So we have a couple of kids who are just sleeping 20 hours a day for a month or so after they have COVID. We're seeing others with chest tightness. We have one young athlete who feels they can't play because they have just such chest tightness after getting COVID. The vaccine seems to be very safe and very effective. And so the risk benefit for kids is still way in favor of getting the vaccine. So we're recommending it for kids 5 to 11. And again, that should be available by the end of this week at all the places that are covering vaccines. So all the pediatric offices, and all the big clinics should be able to get this vaccine by as early as next week. So let me introduce Jennifer. So Jennifer is the Chief Nursing Officer at Lower Umpqua Hospital. Lower Umpqua Hospital is part of the Lower Umpqua Hospital District in Reedsport, and they've been doing just a bang-up job. They had a fairly big size outbreak in Reedsport last October, November, following a Halloween party there. But since then, they've done a great job in getting people vaccinated. They've had a relatively low number of cases of disease, and we've been working very carefully together on their COVID effort. So Jennifer, welcome.
Thank you.
So I understand that you worked previously at Coos in Coos Bay and now have moved up to Reedsport.
Yeah, I used to work at Bay Area Hospital and then moved to Lower Umpqua Hospital as the Chief Nursing Officer in February.
Well, that is great. So we understand that you guys have been doing a lot of screening in the emergency department.
Right.
And that that screening has gone well, and that you've cared for a few patients with COVID, but many of the patients you've transferred to other settings.
Yeah, I think most of our patients were being transferred out until recently when the region had a surge right around the end of August, early September. And then to help level load the patient population across the region, we were keeping some of those lower acuity patients or accepting transfers from those larger hospitals with some of their medical surgical patients so that they could care for those more critically ill patients. So we saw an increase, and we opened, additional beds for our surge capacity so that we were ready for, what the region needed to support all the hospitals.
So for people who are not aware, Oregon has a fairly good hospital system where the hospitals cooperate during times of surge. They cooperate in case places need other equipment. So for example, Mercy was needing some other equipment, and they got it from the VA. Lower Umpqua Hospital needed some stuff, and we were able to get it to them. I think Commissioner Freeman came out to your place today to drop off some tests.
He did. He brought some Binax tests out.
So there's been a lot of cooperation. Commissioner Freeman and I went out pretty much every Saturday last spring when there was no testing available in Reedsport, and we did a testing event each Saturday in Reedsport. But now my understanding is that you guys can do both rapid testing and send out testing.
Yeah, that is true. So we have BioFire that we can do the PCR testing, and then we also send some of our PCR testing out to Quest Labs. We are getting the Cepheid machine, so then we will be able to do additional PCR testing here locally. Soon we'll be expanding to be able to do more timely PCR testing for community members who are traveling. We also have the Binax rapid tests that we do for our EMS tests if they're symptomatic patients. We test all our inpatients, any symptomatic staff, and then we also test patients coming into our ED. We additionally have a same-day clinic that if patients are symptomatic and they're not able to get into their primary care provider, then we will test them down at that same-day clinic as well. Probably again, like end of August, early September, we had a pretty good surge in our community where we were kind of right on the cusp of needing to have maybe an additional testing capabilities like a drive-through site, but then we saw it come down pretty drastically the last month. We've seen our positivity rate decrease, and I would say on average, just patients coming in that are symptomatic, it's between 2 and 8 a day right now between our ED and clinic. So it's definitely gone down, and most of those tests are negative at this point. So.
Well, that is great. You know, that you say that so matter of factly, I will tell you that kind of care, being able to do same-day testing, rapid results, send outs and whatever, is unequaled anywhere in the United States. So I think if I plopped you down anywhere, New York City, Chicago, suburban Boston, you would not be able to get that level of care and that quick almost anywhere else in the country as you can get in Reedsport. So you can get rapid testing, you can get PCR testing, you can get all the things you need. So it really is remarkable with your little hospital how well you guys do.
Well, thank you.
So the other big news in Reedsport this week is the FEMA trailer is in Reedsport. And they already have given hundreds of doses of COVID vaccine. They've been given a lot of flu vaccine. In fact, they called last night and said they'd run out of flu vaccine. So we brought some more over this morning. So really remarkable what they're doing. They're at the courthouse annex for anybody who knows Reedsport, in downtown Reedsport, and it's a drive-through. They've had a little bit of a line, but boy, they move people through pretty quickly, and they've been able to get it done. So I was out there earlier this week. I think the commissioner's out there this week, today, to see how they're doing. So Jennifer, after this is done, I understand the hospitals can continue to do COVID vaccinations.
Yeah, so we currently have a walk-in clinic for COVID vaccinations and boosters every Friday. Currently it's from 12 to 2. Now with the boosters being available, you know, we're kind of monitoring our volume every week on the Fridays. You know, we're prepared to open those hours longer. And then now, since the approval for the pediatric population, we'll be having some community clinics at our Dunes Family Health Center, just to keep that pediatric population separate. And those clinics will be open to any pediatric patients, regardless of whether they're a clinic patient or not. So probably next week or the week after, we'll be getting something out about when those clinics will be held and how people can access that. So
great. Well, we're delivering vaccine.
Yeah.
We're delivering vaccine to the coast tomorrow. So if you need pediatric vaccine, let us know.
Okay, and I think we do. So I'll have our pharmacists contact you.
Great. And Lower Umpqua Hospital has done an incredible job with this. They've really been well prepared. They actually have a specific COVID-19 preparedness person.
Yeah, so just things are just ever changing with COVID. As soon as we think it's starting to kind of level out, something else happens and everything changes again. So we did put efforts into hiring a COVID-19 program manager. She started just this week. Our team has done an amazing job through this COVID pandemic. When our surgery cases decreased, our surgery staff really stepped up to help with our vaccination clinics, our registration staff. Everyone was doing additional tasks, but now surgery's reopening. So, you know, some of those staff need to go back to their regular jobs. And so we really needed that central person to coordinate all of our COVID-19 efforts and kind of bring that all together. So Tanya Lindahl started Monday, and right now she's just learning the ropes and assessing what our current situation is for any community outreach going forward. So.
Well, that's great. So during the pandemic, many routine procedures, and we think about these as routine, but not urgent, but really important. Yes. So joint replacements, knee replacements, colonoscopies, biopsies and such, many of those did not get done during the pandemic because we were focused on acutely ill people with COVID. Right. And now there's going to be a backlog of those cases to get done. Mm-hmm.
Yeah, so I think a lot of times people look at elective surgeries, like you said, as something that's non-emergent, but it often is. It's affecting their daily health. So at this point, our OR is fully open. Even during this recent surge, we were able to maintain our bed capacity where we didn't need to close down our OR. So I think we're starting to see that population pick back up. Those patients that had put off their care earlier in the pandemic are now have access to that care, and we're catching those up.
And we're worried that people who delay things like colonoscopies may find a cancer a year or two later than they otherwise would have. and in which case it might be at a more advanced stage. So we're asking anybody who delayed care during the pandemic to talk with their doctor and see if they can get back on track to do that, because I know both at Lower Umpqua and at Mercy, they're now trying to catch up on those. So the important preventive care that people might have skipped, like colonoscopies, like breast cancer screening, like lung cancer screening for people who are at risk, all really are things that should get done. The other thing is that there have been people who needed hip replacements or knee replacements. It's been really quite a bit of pain and maybe have been unable to do their normal activities. We're hoping to get them back in too. So I'm glad that we're seeing the end of this. So Jennifer, what are you looking forward to as this pandemic ends?
Well, I would look forward to that it ends, but who knows if it will end. I mean, but we kind of, go up and down. I think it just is starting to become more just normal operations is what we're seeing. Things aren't changing as quickly as they were. I think during the pandemic, the biggest challenge for us in healthcare was the rapid changing guidance and adjustments that you needed to do almost on a daily basis to deal with what was coming through the door, what your community was experiencing. So I think just that leveling off to becoming more proactive in our care rather than the reactive stage that we've been in through the pandemic so far. That's what I'm looking forward to.
Yeah, and it's really hard to predict, especially about the future. And so when people ask me, what do I think is going to happen? Well, I always preface that by saying that if there's not a new and unknown variant, right, because it's hard to predict unknowns, but if we stay with the Delta variant, which appears we are now, that what I expect is that we're going to have a moderate number of cases over the next 3 or 4 months, that these cases overwhelmingly will be in those people who are not vaccinated. And that we'll still continue to see hospitalizations and still see, unfortunately, some deaths. But I don't think we're going to see the huge surge that we saw in August of this year or that other places saw at earlier times. And I think this is going to go on probably for the next year, where we're going to continue to have some cases, except for places that never had cases like Taiwan and China. All of the other places have continued to have a low background level of disease where it flares up in an area and then comes down. So I would think we're likely to see that because our vaccine coverage rate in Douglas County is only about 50%. Now it's about 60% in Newsport, but about 50% in Douglas County as a whole. And while lots of people have had the disease, still there is another 20 or 30% of the population who've had neither the disease nor the vaccination. And if this disease comes into your home or into your workplace, they're going to get it. So again, the vaccine is out there. It's safe. It's available. It's now available for everyone 5 and above. It's free. It's safe. It's effective. It's widely available. And in Reedsport, it's available at the hospital. It's available at the local pharmacy. This week, it's available at the FEMA trailer. And in Roseburg, Roseburg in central Douglas County, there are at least 30 sites that have vaccines. So if you're watching this and you've not gotten vaccinated, you're thinking, well, now's the time. Now is the time. Please go ahead and get it. So again, this is Bob Dannenhoffer. I'm so grateful today that Jennifer was able to join us. And we'll do this again next Thursday. Again, this is Dr. Bob Dannenhoffer, the Public Health Officer in Douglas County, on November 4th, 2021. Thank you. Well, Jennifer.